Hi guys, I'm Ravina here from DDW. Today I'm going to talk about mental illnesses. What is mental illnesses? Mental illnesses include a wide range of disorders of thinking, emotion and behavior. There are many different types of mental illnesses. It can be short-lived or long-term. Sometimes it can be hard to tell the difference between mental illnesses and normal worry or sadness. But mental illnesses is more severe, lasts longer and significantly affects a person's ability to cope with life. Almost half of adults experience symptoms of mental illnesses at some point. So yes, depression is very common thing. The main treatments are medicines and counseling, such as talk therapy. Although family, friends and support groups can help people cope with mental illnesses. What are the type of mental illnesses? Mental illnesses is really many different disorders. These disorders fall into broad categories including firstly, anxiety. Anxiety is the presence of excessive anxiety and worry about a variety of topics, events or activities. Worry occurs more often than not for at least 6 months and it's clearly excessive. But the worry is experienced as very challenging to control. The worry in both adults and children may easily shift from one topic to another. Secondly, mood disorders. A mood disorder is a mental health problem that primarily affects a person's emotional state. It is disorder in which a person experiences long periods of extreme happiness, extreme sadness, or both. It is normal for someone's mood to change depending on the situation. Thirdly, schizophrenia. Schizophrenia is a chronic brain disorder that affects less than 1% of the US population. When schizophrenia is active, symptoms can include delusions, hallucination, disorganized speech, trouble with thinking and lack of motivation. Fourthly, personality disorders. A personality disorder is a type of mental disorder in which you have a rigid and unhealthy pattern of thinking, functioning, and behaving. A person with a personality disorder has trouble perceiving and relating to situations and people. Fifth is obsessive compulsive disorders. It is a disorder in which people have recurring unwanted thoughts, ideas, or obsessions that make them feel driven to do something repetitively. Compulsions. Other mental health disorders include eating disorders, stress disorders such as PTSD, and suicidal behavior. What causes mental illnesses? Mental illnesses can have many reasons. A person is likely to have a combination of causes. Number 1. Genetic factors. Genetic factors contribute to mental illnesses. When a parent has a mental disorder, they are high exposed of risk for their children to get. However, it is not necessary that if one person in a family gets, the next generation also gets. Number 2. Early life environment. Negative incident in a person's childhood such as assaultion or abuse can cause mental illnesses. Number 3. Drug and alcohol abuse. When people use excessive amounts of painkillers, alcohol and drugs such as marijuana or cocaine that causes paranoia can cause mental illnesses. Number 4. Biological functions such as chemical imbalances, hormonal changes, or medical condition can cause mental illnesses. Number 5. Personality traits such as low self-esteem can increase the amount of anxiety or depression in a person. Lastly, trauma and stress. When people's traumatic experience increase the risk of mental illnesses, there are prone to also increases. When people have stress in social life or relationship life, there are chances. Also, when they have ongoing stress like final problems, domestic violence, or sexual assaults, they are exposed to mental illnesses. What are the symptoms of mental illnesses? There are many. Number 1. Thinking difficulties and problems. Number 2. Extreme emotional sleep problem. Number 3. Focusing attention highs and low. How can doctors tell if someone has mental illnesses? Firstly, doctors diagnose mental illnesses by talking to the person. Sometimes they will also talk to caregivers or family members. Secondly, sometimes it's obvious that symptoms are caused by mental illnesses. For example, people insisting that they are the president or that their thoughts are being controlled by a radio implanted in their brain. Thirdly, other times it's hard to distinguish mental illnesses from normal reaction. For example, it can be hard to tell normal grief from depression after the death of a spouse or child because both influence sadness and depressed mood. Likewise, the line between being neat or orderly and having obsessive compulsive disorder can be blurry. Any dividing line is usually based on the following: how severe the symptoms are, how long symptoms last, how much symptoms affect the ability to function. That's all about my presentation. I hope you guys all have some points and understanding about my presentation. Thank you all. Have a nice day.